Welcome to Veggie Fest 2025. I'm sitting here today with Dr. Craig Levenson, Director of LA Sports and Spine and founder of the First Principles of Movement. Craig, it's a pleasure to have you here today. I really appreciate your time. So I love the fact tomorrow you're speaking and the title of your talk, How to Make Your Health Span Last Your Lifespan. So what do you mean by that?
What I mean by that is we live in an upside down world where we're living longer, but people are actually older younger. So people are sedentary, they are often overweight, and yet we're gonna live 15 more years at the tail end of our life. So I'm hoping that people will gain a 10-year advantage by investing Warren Buffett style in how to make themselves healthier.
So how do they do that? What are the best ways? Because there's people that are going to be coming to your talk.
Yes.
Some of them are young, some of them are middle-aged, some of them are old. I imagine your approach might be different for each type of group.
Yes, I would agree. That's a great question. You're hired as my marketing manager.
You got it.
I think if I'm seeing somebody who's young and they're like playing in like a sport in college, we think more in terms of 10 days or 10 weeks. If they're more of like a general population person or a weekend warrior, we may think in terms of investing for like a 10-month time horizon. But if I have a premenopausal woman, we're going to think in terms of a longer term investment. We're thinking of a retirement fund. We're thinking of banking lean muscle mass and strength so that at the tail end of your life, you can maintain your independence, you can prevent falls and fractures and frailties and do all the stuff that is important to you.
So, well, that's interesting. So I know your background is you're a trained chiropractor, and of course you have this, you're director of LA Sports and Spine, which sounds somewhat chiropractic, but on the other hand, you're the founder of First Principles Movement. So what is the difference in your approach? In other words, I don't think your practice is all around pure chiropractic as people understand it. It's almost evolved in a different way to be more preventative in nature.
100%. 100%. So we do hands-free chiropractic and it looks like training. So basically we're positive health coaches and the First Principles of Movement is designed to address the worldwide inactivity crisis, which affects rich and poor countries alike. And what we have is this incredible problem today where diabetes has gone from 1% to 10%. It's going to go from 10% to 50%, and nobody's focusing on prevention. Western medicine is great at treating disease. It's not great at promoting health. And so our mission with First Principles of Movement, and what I do boots on the ground with every client that I see at LA Sports and Spine, is we empower people. We help them to feel like badasses. We want somebody who walks in feeling disabled or in pain to walk out feeling that they can achieve the things that are important to them or that they value.
So what is your approach? If somebody comes in as a new patient, and maybe they're diabetic or maybe they've got some other comorbidity, how do you treat them? Is it a more of a holistic approach? Is it all about manipulation? How are your patients treated day in and day out? What's a typical plan?
I love that question. And holistic is a loaded term, but we don't do it. It's hands-free. So the first thing is,
and can you elaborate on what you mean by hands-free?
Hands-free. I only touch people like 2% of the time. So there's very little manipulation or manual therapy. And we really want to hear people's story. So we're passionate to hear people's story, and we ask a very simple question. Tell us what matters to you. And we unpack what matters to them. What do they value? What are they striving to get back to? Instead of focusing on their symptoms, we want to get to the upstream things that are really their goals. And when I know a person's goals, we can reverse engineer the steps to get them back to that. So it's very much person-centered. It's not about me, it's not about my techniques. It's about them and it's about what matters to them.
So when people come to you, they, again, I think of, you have a practice, LA Sports and Spine, people think about, oh, it's chiropractic care, but it sounds like people are coming to you for a whole host of reasons, ailments, other types of things that you're able to treat, like you said, in a hands-off approach.
They don't even know I'm a chiropractor. People get referred because we do something magical. We free people so they don't feel like they're doomed. They don't have wear and tear. They're not worried about their scan anymore. They know that they can build their muscles at any age. They can build lean muscle mass and strength, and they get back to all the things that maybe they've started to become insecure about or feel like they were slipping away, and they hit an expiration date. We just want to make people feel younger. We want to literally give people a 10-year advantage by highlighting simple, safe ways to to regain things that they thought it was too late for.
So as I look at your approach, it's interesting because I know you're a well-known researcher, you're an author, you speak all over the world. But with this hands-off approach, how has things evolved? You've been doing this for 30 or 40 years right now, and what has changed in that period of time, and where do you see it going?
I used to baby people. So we live in a palliative society. And instead of me always doing chiropractic work and hot packs and massage, I did some of that. Now I do much less. And I did a lot of low load exercises. Now we realize that people aren't fragile. The body is built to last, it's not built to break. And so we want to challenge people so they become more resilient. So there's two things that we hunt for. One are challenges that they can tolerate that build up their physiological armor. And two is their psychological resilience. We want to make people feel more confident. We want to build their self-efficacy so they literally are empowered. And this happens from a hospitality lens beginning on day one. We find a safe entry point. And it's not complicated, and everybody is different.
You've been a longtime friend of Veggie Fest, but I think this is your first time speaking at the festival. And Veggie Fest is all about healthy living. And I think about that healthy body, healthy mind, healthy spirit. What were you thinking in terms of when you were invited to speak here? What was the idea of how your practice and your approach aligned with the message of Veggie Fest?
Well, one of the principals of the Veggie Fest, John Kruger, is a friend of mine from way back, as are you, Douglas. And Kenny, who's a physiatrist here, is also intimately involved with the mission of Veggie Fest and promoting these things. And I've been working with Kenny for years, helping to train him. And together, I think the connection is strong enough that the idea finally occurred to my old best friend, Jonathan, oh, why don't we invite Craig? And I'm honored to be here. It's a special privilege to be here, surrounded by people who are committed to kind of thinking differently, thinking outside the box about health, healthy living, mind and body. And really at the end of the day, it's not about the body, it's about the mind. It's not about the body, it's about the spirit. And we think about pillars of health: sleep, stress, diet, movement, social connection, substances. We want people to not be associated with alcohol abuse. We want people to eat healthy. We want people to move. Just start moving. If you're not moving, just start moving. We want people to do some meditation, to learn how to quiet and still the mind. All of these things, they're all super important. I even heard a talk last night about how sleep is important. If we don't sleep, then all these other things, they don't matter. If you can't recover, then the next day is already lost.
Okay. Well, Craig, thank you so much. It was a great opportunity to speak to you. We've known each other for many years. It's really wonderful to hear you in this context, and we're thrilled to have you at Veggie Fest. And thanks to everybody for joining us this afternoon. And we look forward to seeing you at Veggie Fest 2026 next year.